All right, welcome to the podcast today. Thank you for joining me. I'm really excited to have one of our doctoral students with us today. Madie, can you introduce yourself? Tell the listeners your name, when you'll graduate, and what area of practice you think you might want to practice in once you're done.
Okay. Well, my name is Madie Specht. I'm in my third year of the OT program, and I'm doing my capstone project at a post-acute neuro rehab facility. So I will graduate in May of 2026, and I'm hoping to work in some type of neuro rehab setting. Not exactly sure if I want outpatient, inpatient, acute care. Not really sure yet. So kind of open to anything.
Awesome. Awesome. So, in your community advocacy and leadership course, you've identified and been exploring an occupational injustice from current events. Can you tell us a little bit about what you've been focusing on and what made you interested in that topic?
Yeah, absolutely. So my injustice is basically the lack of affordability of traumatic brain injury treatment. A lot of times, like insurance can dictate outcomes through like the services they wish to cover. If they aren't making substantial progress according to the insurance companies can stop providing coverage. So a lot of time, it's very hard to find like ongoing services that are affordable, which can definitely influence outcomes. So I just thought it was interesting to look at all this because I'm working with this population for my capstone. When I was at my capstone site, I talked to my site mentor about it. So it's just something I was really interested in learning more about because that's a population I am interested in working in.
Great. And so how is this topic relevant to OT and advocacy?
So we have a unique perspective where we kind of understand that holistic view of the person. And a lot of times, what I noticed throughout my research is when they aren't able to access these things like occupational therapy, physical therapy, speech, especially when they're ongoing and going back into the community, it influences occupational engagement a lot. I found a lot of negative outcomes just because these individuals aren't able to get the same opportunities. And it's definitely can be addressed through OT because we understand how important it is for them to be engaged in these kind of things. We also understand how you can provide advocacy for them, instill self-advocacy for them through interventions. So I think we just have a very good understanding of all of it, which puts us in a great position to kind of help advocate for them.
In your research, did you find that this is impacting certain populations more than others within the traumatic brain injury community?
Nothing within the traumatic brain injury community other than in more rural areas, especially because we live in Wisconsin. Up north, there's not a lot of resources available. So I did notice that was kind of a factor, geographical location, pretty
Okay.
much, because when you're not in those bigger cities and treatment isn't super accessible, it's really hard for transportation too, because a lot of
Yeah.
times it has to be organized beforehand. So a lot of them miss appointments, can't get appointments. So that can definitely play a role.
And so, if OTs listening are wondering about specifics about this, you talked about insurance reimbursement. Are there specific companies that you found that are maybe better or worse for covering this? Or what kinds of maybe statistics did you find related to this topic?
So one thing that I thought was really interesting when I was talking to my site mentor, she said they don't accept Medicare. So a lot of times patients at their facilities are under 65 who don't qualify for Medicare services. They
Okay.
said that Medicaid typically provides really thorough coverage at their facility, but a lot of times private insurance might not. And when
Okay.
they have private insurance, they're required to have a backup form of payment because private insurance are much more likely to all of a sudden, oh, we're not covering this anymore, or I'm not seeing that progress that we should be seeing, so I'm done covering this. So private insurance typically provides more of difficulties with that is a lot more like OTs advocating for why those services are necessary and why progress is still being made. Because if that's not shown, like they can get dropped from services very easily.
Hmm. Interesting. And Medicaid would take a little bit of time to qualify, I'm guessing after an accident. Do you know anything about that process? Like if they weren't on Medicaid before, if the Medicaid is because of the disability from the brain injury, I would guess
Yeah,
they don't have access to that right away.
Yeah, nothing time frame wise that I know of, but I would also assume the same thing that it's not something you immediately qualify for. So I'd imagine like during your acute stay, there's a lot of paperwork, a lot of things that have to happen in order to get those services covered. So that'd definitely be something to look into more.
Um, okay, so if OTs who are listening want to do something about this, what
Yep.
kinds of actions can you recommend for people to advocate for this topic?
So one organization I've been working with is the Brain Injury Resource Center of Wisconsin. They abbreviated BIRC, so the BIRC, because it is a mouthful to say. They actually do a fantastic job with resource allocation. They have a huge site on their website. And when I was visiting one week, we actually were going through every single link to make sure they still work. So it's not like you go on, you click on links that were put in 5 years ago and they don't work anymore. They go through it, they update it all the time. They have a whole resource directory. So that's a really, really good place to start for OT practitioners if they want to help instill like self-advocacy for their patients. And
Okay.
hey, this is a resource you can use. Here's how we use it. Here's how we go through it. So that's a great organization that I would recommend reaching out to or contacting if you're either a patient or an OT. Additionally, the TBI Reauthorization Act of 2024
Ooh.
is they're trying to pass it right now. It has passed the House and is now in the Senate, or has passed the Senate and is now in the House. Whatever order it goes in.
Okay.
But basically, it aims to increase funding and therefore like accessibility of resources. It calls for the CDC to designate TBIs as chronic conditions, which would open
Mhm.
the door for a lot more continued treatment for this condition. It also aims to increase TBI state partnership programs from 7.3 to 19 million. So this is actually just doing a lot. Yeah, it's over double. So it just does a lot in terms of increasing funding, which would make resources more affordable, more accessible. So if you go on the Brain Injury Association of America's website, on their homepage, they actually have a little thing that kind of scrolls through, and you can click on a link that will take you to a form to sign and just send a letter to legislators in your state. So you just put in where
Okay.
you're from, and it'll send it to a local legislator, like a representative, just kind of advocating for that. So that's something simple you can do. It takes 2 minutes. I did it. So
Excellent. I will link that in the notes for this episode so that people have easy access to it. That's really great to know that there's something currently in legislative action that we can call our people. And so using that link would be great. I think we talk about a lot, like actually calling your senator if you are calling the office, talking to staff, letting them know how this would impact patients would be even more impactful. So for listeners out there, talking to legislators is not that scary. They're real people. I would encourage you to for sure go on the link and check out what that letter is, but also do a personal reach out to your senators so that they know people are really interested in making this go. Um, Awesome. What else, anything else you would want people to know? We're going to shift gears and talk a little bit about advocacy in general as a student. But before we switch topics, anything else you want to share about this topic that listeners should know, or things that you want to highlight?
yeah, so I do just have a few statistics as well, just about the amount of people this impacts, because I feel like if you don't have experience with a traumatic brain injury or a loved one doesn't have a traumatic brain injury that you know of, it's hard to kind of wrap your head around it. And we just did our social media campaigns last week in our advocacy
Mhm.
class, and a lot of people would vote wrong. They'd vote way under what it should be. And they're like,
Sure.
wow, that's actually crazy. So I did find that each year, 2.8 million people experience a traumatic brain injury. And currently, there are 5.3 million people in the United States living with long-term disabilities. So now that we know that, 60% of those are unemployed 2 years after traumatic brain injury because of the ongoing impacts of it. And average like traumatic brain injury rehab daily hospital cost is $8,000, and rehab centers can range from 850 to $2,500 a day. So you can
Wow.
see if insurance is not providing thorough coverage, or you have high deductibles, high out-of-pocket costs, or your insurance company could drop you. those kind
Mhm.
of things can be very, very scary. And it's impacting a lot more people than I think you or I would have thought of before hearing
Yeah.
that.
Yeah, those numbers are astounding. I would not
Mhm.
have guessed those numbers.
Yeah.
So if insurance drops, coverage drops, people are just discharged. They don't have access anymore. They just have to go home.
Yeah, so a lot of that would be where we come in because
Mhm.
obviously you don't want an insurance company to just stop providing coverage. I know obviously at my facility, like I said, if they have private insurance, they need a backup payer source because if they get dropped, they need something else. But it's
Mhm.
also a lot of fighting as an OT and as like family or the individual with the TBI, just fighting with insurance companies, having to get on the phone, talk with them. I need this covered. Like this is why. As providers, that's a big role we can play as well because we have that unique like knowledge of, hey, this is why it's going to benefit
Yeah,
them and continue to benefit them. Because when they are dropped, it is a lot of like scary feelings where I need to either pay this or I need to find a different option for insurance like right away, or
right.
I'm not going to be able to do these things anymore and get these services.
Yeah, that is scary. I mean, our clients and their families would, I mean, that to be left without support in that situation is just really like I think we would think that's not an option, right? Like we we can't just say, okay, bye, you're done.
Yeah.
We're not doing this anymore. So, um, well, awesome. I'm excited to see what you do with your capstone. Do you want to share a little bit about where that's going or what you're kind of looking at for your capstone project for your doctoral degree?
Yeah, for sure. So I'm actually planning on doing like a mini podcast series for my capstone, which is interesting.
Awesome.
So I chose that because it's very customizable to what my site needs and what kind of
Mhm.
we identify as we're going along. I can add an episode, take out an episode. Right now, my goal is to basically raise awareness on what it's like living with a traumatic brain injury, how we can support them as healthcare professionals, how families can become more equipped to care for them. There's a lot of gaps in that I found in like continuity of care were focused around like loved ones weren't fully informed on what to expect
Mhm.
when they took
Sure.
the individual with the TBI home, as far as like the lasting effects, like financial effects and how to manage finances following that. So I want to actually bring an individual with the TBI onto my podcast series and a family member on a different episode of my podcast series.
Sure.
So I can kind of get that firsthand perspective. So I think I can talk about it all I want, but
Yeah.
unless you're hearing it from somebody who has first world experience with it, I feel like that's going to be much more impactful. So I'm excited to see where that takes me. I don't have the
Yeah.
exact specifics of all the episodes laid out. That's something I'm going to work on more next semester as I talk with my site mentor about that. So I'm really excited to see where that goes.
Awesome. Awesome. So I'm going to shift gears a little bit and talk about student experience. So I want to talk about the advocacy process as a student. So how has this been for you? Did you have any experience with like community advocacy prior to this class? And what would be the biggest like takeaway from doing this project?
So I would say my experience before this class was just in like the advocacy classes we've had previously. So it wasn't focused around community advocacy. It's more just personal advocacy. And I would definitely think since first semester, I've grown a lot with that. I used to be a lot more like reserved. I'm not going to be able to change it, but you can. I'd say the biggest takeaway that I found is small changes are still changes.
Mhm.
Like I said, just going on the Brain Injury Association of America's website and signing that. I also found that if it feels like too much, there's a way to break it down to make it manageable. Obviously, I'm not going to contact every insurance company in the United States and tell them they need to provide coverage all the time for individuals with TBIs. But just finding little ways that you can, like passing the TBI Reauthorization Act 2024, contacting, I looked at even if contacting like senators feels like too
Mhm.
much, look more local. I looked at the representative for my like congressional district in Wisconsin, so Glenn Grothman,
Yeah.
just looking at somebody who's slightly like below that you can talk to. He feels like he might feel a little more personable, a little less scary to reach out to than a senator. And from there, you can work with him and you can kind of
Yeah.
work your way. So I think that's the biggest thing I've learned is it might seem scary, but there's still things that you can do, and we all should be doing things like that. So
Awesome. I love what you said, like small changes are still changes. And I
mhm.
think that that goes from a community advocacy perspective, but also personally too, because um, that's one of my favorite things throughout the program is watching students grow from that first class when I say, how many of you like to enter a debate or have conflict, and nobody raises their hand. And I think at the end of the program, there might be a few more hands raised, like I'm willing to do that, where before I maybe wasn't. And getting to see those skills develop, I think, especially as women, we tend to not advocate for ourselves as much either. And I was just reading some articles about still the wage gap in genders and between genders, and that some of that, a lot of that is coming from women not being willing to negotiate, right? And so I think just in so many ways, knowing that like what you offer is valuable, and then taking those small steps to really build the confidence to go out and say, yeah, this is what I want and this is what should be changed. So
Yeah,
that's great. What has been the most challenging part of the project?
I would say the most challenging part of my project is breaking it down to make it manageable. I know I kind of was talking, even during my needs assessment for my actual capstone project, I was talking to my site mentor and we were going through all this and like it just seems like there's so much I don't know what to tackle. And I talked to Dr. Bong too. She's like, you're not supposed to tackle everything. Like within my injustice, break it down, find something
Mhm.
because something is better than nothing. And so I feel like that was the most like daunting part at first is like getting started. It's like I don't know
Yeah.
exactly where to start, what topic to exactly address. I know this is important, but it's so large. What can I do about it? Kind of thing.
Yeah.
So I'd say that was definitely the most difficult is just finding the starting point and kind of seeing which direction I wanted to take it.
And so flip side of that, what's been the best part of the project?
I would say seeing the impact it had because I did a lot of research on this population, obviously, throughout the semester, and I didn't know like any of
Mhm.
this information. Like reading it and just seeing how I can make a difference with that large amount of people was just really rewarding. So I learned a lot from it, and I'm super glad that I was able to do this whole project.
Awesome. So you've done your social media campaign. What was the engagement with, what platform did you use? And then what was your engagement like?
Yeah, I used Instagram,
Okay.
and for I would say the polling days had more interaction because I think people just like clicking, you know.
Yeah.
So
Yeah.
on those days, probably about 70-ish% of my viewers responded to the polls. So I
Okay.
had like a little over 100 views and then like 80-ish responses to most of the polls on those days. So
That's awesome. So yeah, I mean, that's great. That's great exposure. Right now, that's 70 people who, or 100 people who have a little bit more knowledge about this, which
yeah,
um, that with the number of individuals experiencing TBI, you know, the likelihood that people in our life are going to come across either a loved one or a friend or somebody with a TBI is fairly high with that
yeah.
incidence rate. Awesome. So, can you talk about just in general how you think advocacy should be integrated within an OT's role? So, like, what is because I will hear a lot of OTs say, I mean, I'll advocate for individual clients, but at this level, that's like beyond maybe what I have to do. Um, and you can agree or disagree with that, but what are your thoughts in general about OTs and needing to advocate?
Yeah, so one of the articles we read at the beginning of the semester talked about how like understanding that as OTs we should advocate is different from knowing how to. And I definitely
Hmm.
agree with that. I think our program does a very good job of teaching us you should be doing it, but here's how. And
Hmm.
a lot of that stems from you see something going on with a patient or patients, like whether you're working with a certain population, you notice these things. At the individual level, advocacy is still great. Like we need to
Hmm.
advocate for
Yep.
every single client, but at a population level, doing the kind of things I talked about, like seeking out, okay, what kind of legislation is being passed?
Hmm.
What are barriers to care that these populations are experiencing? And like, what can I do about that? So going out of your way to do some research. Like I said, the Brain Injury Resource Center of Wisconsin has that resource directory. So maybe if I
Hmm.
see something occurring, like people aren't able to access these resources, how can I find them for them? And then
Hmm.
instill that self-advocacy too. I think self-advocacy is a huge component of OT that we can help instill in our clients.
Yeah,
Whereas like us providing advocacy is awesome, but also inspiring like our patients to be able to do the same and their families to be able to do the same. So that when we are done seeing them, that's still continued.
awesome. Okay, so I have two questions that I ask everybody who comes on the podcast. So first, what area of life or practice do you think OTs should have a bigger role in? And it can be related to what we've been talking about or totally unrelated.
Ooh, that's a good question. Honestly, now that I've done this project, I'm a little biased, but I think like at a legislative like level, I think having an OT in that kind of level would be awesome because not at least that I know of, we're not really involved in that, but having the perspective of working with like health and human services type departments where
Mhm.
okay, this is kind of legislation we're passing for like our citizens, and we could
Yeah.
have the perspective of this is what we need, this is why we need it, this is why this
Mhm.
should be passed, or this is why this should be revised. I think that would be something that'd be really cool to kind of look into, especially now that I've been looking more at legislation with my population.
Yeah. We just had one of our first occupational therapists voted in, I can't remember, is it in the Senate? Um, but so super fun.
Hmm.
To see that I know we celebrated at the AOTA conference. And some I've seen a couple other OTs who are at the state level in legislation. But yeah, I mean, I think again, thinking about what our OT perspective can bring at that level is really
Yeah.
interesting to consider. Okay, last question. What current occupation brings you joy?
I like going for walks. I go for a walk with my dad and my two dogs every single morning. We're actually going after this. So that brings
Awesome.
me joy. I can just get outside. Even if it's cold out, you're still able
Yeah,
to get and walk around and get some exercise. So
excellent.
that brings me joy.
Awesome. Yeah, well, thank you so much for spending some time with me this morning. I know it's a little early and cold in Wisconsin here. So thank you for that. And I look forward to seeing all the things that you are going to be doing in the future. So thank you so much.
Thank you for having me. I appreciate it.